Hi, my name is Rob Mills. I'm a student physical therapist at the University of Kentucky, and today I'm here to talk to you about a better way to healing than opioids. Many people across the United States and the world struggle with opioid abuse and addiction, and I'm here to tell you that there is a better way to treat your chronic pain than to take opioids. So, what is chronic pain? To understand chronic pain, you first have to understand the normal pain response. Normal pain response is when you have an injury, you feel pain in order to let you know that you have an injury to protect that area. As the injury heals, though, the pain should go away. With chronic pain, the pain never goes away. Even long after the tissue is healed, pain sticks around and never goes away. So, for a patient who presents with chronic pain, they may appear to have pain for no apparent reason. You find no evidence of damage, no evidence of injury, but they still have pain. And many people don't understand that the reason for this pain is multifaceted and there's lots of things contributing to this amount of pain. So, how do opioids work? Opioids work by activating the part of your brain that deals with rewards and pleasure. And by activating this part of the brain, it blocks the part of the brain that allows you to feel pain. But opioids overstimulate this part of the brain that allows you to feel pleasure so that normal activities that used to be pleasurable are no longer pleasurable, such as eating, sex, exercise, anything of that nature. Those types of things cause a normal response in pleasure, and that is no longer effective in making you feel any sense of pleasure. Opioids also oversensitize the part of the brain that deal with stress and anxiety. So you increase your levels of stress and anxiety with opioids. Changing the way the reward and anxiety systems works together helps lead to poor decision making and then drug seeking behavior, which encourages patients to take more and more of the drugs, even when that's not necessary. So, what is addiction? According to Merriam-Webster, addiction is defined as a compulsive, chronic, physiological, or psychological need for a habit forming substance, behavior, or activity having harmful physical, psychological, or social effects and typically causing well defined symptoms such as anxiety, irritability, tremors, or nausea upon withdrawal or abstinence. This is all true for opioid addiction. Uh, Abstaining from taking these drugs can cause negative physical side effects, and they also cause anxiety, irritability, and can lead to the other negative side effects as well. Due to constant overstimulation of the reward and anxiety systems of the brain, people who are addicted to opioids continue to seek the drug to feel the desired effect. The body, though, begins to become accustomed to the level of drug in your system in order to auto-regulate itself, removes receptors from the brain so the drug can't activate as many receptors. Therefore, in order to get the same effect that a smaller dosage was giving you early, you need much more drug in the system. This causes a vicious cycle of patients increasing their dosages in order to get the same effect that they were getting that a much lower dose once provided. According to the National Institute of Health, 2 million Americans a year misuse their opioids, and in 2016 alone, 20,000 people died from an opioid-related death. So why are opioids the worst choice? According to a study by Cordier Scott et al., studies have not been conducted to determine if opioids control chronic pain after a few months. Opioids can have serious risk, and there is evidence that other treatments can be effective with less harm. Opioids can cause people to stop breathing and die, especially at higher dosages or when combined with alcohol, medications, or other substances. So opioids are not only not as effective at treating pain as other treatments, they also have very large side effects. If taking this opioid is not going to treat your pain and going to be very risky, why not try something that is less risky and more effective? Due to the high rate of addiction to these drugs, the best course of action is to take them for the shortest amount of time possible or not at all when possible. So there is a better way than an opioid. Physical therapy is that way. According to a study by Glakowski et al. In 2014, although their evidence supports the use of physical therapy, studies are conflicting regarding the usefulness of opioid analgesics in patients with chronic low back pain. So for the patient with chronic low back pain, which is a very common musculoskeletal disorder that leads to chronic pain, opioids are not as effective as physical therapy. Physical therapy will lead you to a life without pain. So what can a physical therapist do for your chronic pain? Physical physical therapists, first and foremost, are educators. They will give you the information as to why you are still in pain, what is causing the pain, and then they will treat you to get you out of pain for a longer period of time, maybe even permanently. Pain relief comes through exercise. Lots of pain in the body from musculoskeletal disorders comes from an inability to stabilize or a lack of strength. Physical therapists will treat these issues, which are the root cause of your pain, thus getting you out of pain more permanently. Physical therapists do an incredibly thorough examination. We take the entire patient's life into account, and all the information is synthesized to give the best treatment possible for the patient. We don't treat symptoms, we treat causes. Physical therapists also have an open dialogue with their patients. Physical therapists spend more time with their patients than any other healthcare provider. And that open dialogue allows physical therapists to get more information out of their patients. And this information can sometimes be critical in treating the pain in the most effective way for that patient. Physical therapists treat lots of issues, but sometimes we need help, and we are a great point of contact for referral to somebody else who may be able to help you with a certain aspect of your chronic pain journey. So you need help. How do you get started? Call or email your local physical therapy office. Ask if anybody in that clinic specializes in treating chronic pain. If there isn't anybody in the clinic that treats chronic pain specifically, every physical therapist has knowledge on how to treat chronic pain levels and help reduce your pain levels. Bring a notepad. Physical therapists love to teach. They will give you lots of information on your first day, and having this information will be great to refer back to when you need it. Come with an open mind. Physical therapists may tell you something that you haven't heard before. Be willing to listen and be willing to try the things that they are telling you. It will help. Remember, healing takes time. Physical therapy can make a huge difference, but it will take time. You will not get better in a week or two. It is a journey that physical therapists will help guide you through. Everybody wants to see you get better, and our main priority is to make sure that you have a pain-free life or as low of pain as possible. Using opioids mask your pain. They do not treat pain. So why not try physical therapy, which might treat your pain and thus give you a long-term reduction of symptoms instead of just covering up the symptoms that will always be there. Here are some extra resources if you need them. Substance Abuse and Mental Health Services Administration, also known as SAMHSA. They do rehab if that is something that you're interested in. Physical therapists can help guide you to a local facility. But if you would like to look into it on your own, here is a website that will help you guide you to treatment facilities in your area. The APTA, which is the governing body of physical therapists, also have a website that will help you find a local physical therapist in your area if you need that help. Here are my references for my presentation today. Thank you and have a good day.